HIV, or the human immunodeficiency virus, is a global health challenge. It attacks the body's immune system, making it difficult to fight off infections. Over time, HIV can lead to AIDS, acquired immunodeficiency syndrome. AIDS is the most advanced stage of HIV infection. It is a life-threatening condition that leaves the body vulnerable to opportunistic infections. HIV continues to affect millions of people worldwide. The impact is felt across all continents and demographics. Understanding HIV, its transmission, and the importance of testing is crucial in the fight against this global epidemic. HIV testing is the only way to know if you have HIV. It is a simple blood test that looks for the presence of the virus or antibodies produced by the body in response to the virus. Knowing your HIV status is essential for several reasons. Firstly, early diagnosis allows for timely initiation of treatment. Early treatment can significantly slow down the progression of HIV. It helps preserve the immune system and improve long-term health outcomes. Secondly, knowing your HIV status allows you to make informed decisions about your health. It empowers you to take necessary precautions to protect yourself and your partners from HIV transmission. There are two main types of HIV tests: rapid tests and laboratory tests. Rapid tests provide results in as little as 20 minutes. They are commonly used in point-of-care settings and community outreach programs. They offer the advantage of quick results, making them suitable for situations where immediate information is crucial. These tests are particularly useful in emergency situations, mobile clinics, and areas with limited access to healthcare facilities. They can be administered with a simple finger prick or oral swab, making them less invasive and more convenient for many individuals. However, while rapid tests are highly effective, they may require follow-up testing to confirm a positive result. Laboratory tests, on the other hand, are performed on blood samples sent to a laboratory for analysis. They are highly accurate and can detect HIV earlier than rapid tests. While laboratory tests might take a few days to provide results, the added accuracy and sensitivity make them valuable tools in HIV diagnosis. These tests often use advanced techniques such as ELISA or Western blot, which can identify the presence of HIV antibodies or antigens with high precision. The choice of HIV test depends on various factors, including the individual's needs, the testing setting, and the urgency of the results. Healthcare professionals can guide individuals in selecting the most appropriate test based on their specific circumstances. It's important to consider the context in which the test is being administered, the availability of follow-up care, and the potential need for confirmatory testing. By understanding the differences between rapid and laboratory tests, individuals can make informed decisions about their health and well-being. HIV tests work by detecting the presence of either the virus itself or antibodies produced by the body in response to HIV infection. Antibodies are proteins produced by the immune system to fight off infections. When a person contracts HIV, their body produces specific antibodies against the virus. HIV tests are designed to identify these specific antibodies in blood or saliva samples. Rapid tests typically detect antibodies through a finger prick blood sample. Laboratory tests, on the other hand, often analyze a venous blood sample for the presence of antibodies or the virus itself. The accuracy and reliability of HIV tests have significantly improved over the years. Modern tests are highly sensitive and specific, meaning they are very good at correctly identifying people with and without HIV infection. While HIV tests are highly accurate, there is a small chance of receiving a false positive or false negative result. Understanding these possibilities is crucial for interpreting the results correctly and taking appropriate actions. A false positive result means the test indicates the presence of HIV when the person is not actually infected. This can be distressing and may lead to unnecessary stress and anxiety for the individual. This can occur due to various factors, including cross-reactivity with other infections or medical conditions. For instance, certain autoimmune diseases or recent vaccinations can sometimes trigger a false positive result. On the other hand, a false negative result means the test fails to detect HIV when the person is actually infected. This can be particularly dangerous as it may lead to a delay in receiving necessary treatment and care. This is less common but can occur during the window period, the initial period after infection when the body has not yet produced enough antibodies for the test to detect. During this time, the virus is present in the body, but the immune response is not yet strong enough to be measured by the test. It is crucial to remember that initial positive results are always followed up with confirmatory testing using different methods to rule out any discrepancies. These confirmatory tests are designed to provide a more accurate diagnosis and ensure that the initial result was not a false positive. This ensures the accuracy of the diagnosis and minimizes the risk of false positives. By following these protocols, healthcare providers can offer the best possible care and support to individuals undergoing HIV testing, ensuring that they receive accurate information and appropriate follow-up. The latency stage, a period of silent replication. After the initial infection, HIV enters a stage called the latency stage. During latency, the virus continues to replicate within the body, but at very low levels. This stage can last for several years, and people in the latency stage may not experience any symptoms of HIV infection. The latency stage is characterized by a delicate balance between the virus and the immune system. The virus continues to replicate, but the immune system manages to keep the virus in check, preventing the development of AIDS-defining illnesses. It is important to note that individuals in the latency stage are still infectious and can transmit the virus to others. This highlights the importance of regular testing and early diagnosis, even in the absence of symptoms. The importance of understanding latency. Understanding the latency stage is crucial for several reasons. Firstly, it emphasizes that HIV infection can be present even without any outward signs or symptoms. This reinforces the importance of proactive testing, especially for individuals who may have been exposed to the virus. Secondly, the latency stage provides a critical window of opportunity for early intervention. Starting antiretroviral therapy, or ART, during latency can significantly suppress viral replication. This prevents the progression to AIDS and helps preserve the immune system's function. Thirdly, understanding latency helps dispel the misconception that HIV is no longer a serious health concern. While advancements in treatment have significantly improved life expectancy for people living with HIV, it remains a chronic, manageable condition that requires ongoing care and attention. Breaking the silence: regular testing for early detection. Regular HIV testing is paramount in the fight against the epidemic. It is a critical step in ensuring that individuals are aware of their status and can take the necessary actions to protect their health and the health of others. It allows for early detection, timely treatment initiation, and effective prevention of transmission. Early detection can significantly improve health outcomes and reduce the risk of HIV-related complications. Health organizations recommend that everyone between the ages of 13 and 64 gets tested for HIV at least once as part of routine healthcare. This recommendation is based on the understanding that early detection is key to managing and controlling the spread of HIV. For individuals at higher risk of HIV infection, such as those with multiple sexual partners or who inject drugs, more frequent testing, such as every 3 to 6 months, is recommended. This ensures that any new infections are caught early and managed promptly. Regular testing empowers individuals to take control of their health. Knowing one's HIV status is a powerful tool in making informed decisions about treatment and prevention strategies. It allows them to make informed decisions about their well-being and protects their partners from potential transmission. By being aware of their status, individuals can take steps to prevent the spread of HIV to others. Breaking the silence surrounding HIV testing is crucial for creating a supportive environment where individuals feel comfortable accessing testing and care without fear of stigma or discrimination. Open conversations and community support can make a significant difference in the fight against HIV. Conclusion: knowledge is power in the fight against HIV. HIV testing and understanding the latency stage are vital components of the global response to the HIV epidemic. Early detection through regular testing allows for timely intervention and significantly improves health outcomes for individuals living with HIV. Moreover, understanding the latency stage emphasizes that HIV infection can be present even without symptoms. This underscores the importance of proactive testing and early initiation of antiretroviral therapy to suppress viral replication and prevent the progression to AIDS. By breaking the silence surrounding HIV testing and promoting open conversations about sexual health, we can empower individuals to take control of their well-being and contribute to a future where HIV is no longer a major public health threat.